ITP has been long thought to be a disease only of young women, but now we know it's very common in young people as well as older people, and it's increasing frequency in older people. The main problem with ITP is that we have gone from an era of taking people's spleens out and giving them long doses of steroids, and now we're in the era where patients have effective medical therapies for many aspects of ITP, particularly we can get the platelet count into a safe range for most patients who have this disease. We're now entering a new phase in treating ITP with medications and therapies that might make the disease disappear, and that might make the whole process be a disease which is now cured. So we're going from treatment to cure in terms of ITP. But the main challenges right now in most ITP patients or adults is to find an effective therapy which gets the platelet count into a safe range, prevents bleeding, and improves the quality of life. The study with rilzabrutinib was done in patients with highly refractory ITP. Many had disease for anywhere between 6 and 8 years and failed on average over 5 different kinds of therapies in prior years. So we're looking at a very unusual set of patients with ITP, but we gave patients with ITP rilzabrutinib, and overall 29% of patients had a response to this drug. No one in the placebo group had any response to the drug in terms of a raise of platelet count. This is a very rigorous criteria. We had to have a platelet count be over 50,000 on 2/3 of the last 12 weeks of the clinical trial, which is a very stringent and restrictive criteria. Overall, some 65% of patients given rilzabrutinib had a rise in platelet count over 50,000, which is another endpoint. Most current therapies for ITP raise the platelet count and reduce bleeding in the vast majority of patients treated. What's unique about this study is the effects of rilzabrutinib improve the quality of life of patients aside from a platelet count and aside from bleeding. Fatigue is present in the vast majority of ITP patients, and this is the first study that has quantified fatigue as a result of drug therapy. What we found was that patients who had what's called durable response, a platelet count over 50,000 on 2/3 of the last 12 weeks of the study, had a marked increase in their ability to not be fatigued. Patients in the placebo group had no improvement in their fatigue and actually declined. But what was amazing is patients who did not quite have the most robust platelet response also had improvement in fatigue, suggesting this medication may work via alternate pathways, such as anti-inflammatory pathways, to improve the quality of life of patients. But in general, this is a very difficult to treat patient population, and if we start using this drug in earlier stage disease, we'll find that improvement probably is even better. Well, the major thing about BTK inhibitors is they have been used a lot in cancer patients. The current BTK inhibitors all alter platelet function or reduce platelet function to the point that bleeding is a common complication of other BTK inhibitors. Rilzabrutinib has been designed to get rid of those specific things, and rilzabrutinib, unlike the other BTK inhibitors, does not affect platelet function one tiny bit. Furthermore, it does not have other BTK attributes such as causing atrial arrhythmias or atrial fibrillation. In this study, the major side effects of getting rilzabrutinib were little different than those in the placebo group. Diarrhea, which is low grade, may happen in a small percentage of patients. Infections did not increase compared to placebo patients. And we tend to do clinical trials in ITP and categorize bleeding as an adverse event when indeed it's a beneficial event. And in the patients on the study, bleeding events dropped significantly